We're here to talk about how virtual acute care is changing and what are some of the emerging technologies and solutions that we expect to see by 2030.
That COVID-19 pandemic, the onset and the potential closure has changed the way virtual care is being perceived and delivered across the healthcare industry. So the pandemic exposed operational, clinical, and financial challenges within the healthcare environment. As per our last research, we expect the virtual care market to reach about 57.3 billion by 2029, and this is inclusive of both inpatient and the hospital at home environment.
This space in virtual acute care, like acute care market overall, has seen a real uptick in recent years because of staffing, monitoring, financial challenges of healthcare organizations, and that's accelerated as we've seen really since the pandemic.
Here at Equum, for example, we're increasingly partnering with technology companies to create a more robust and all-in-one virtual care platform. And the reason why is hospitals want a single disintermediated partner that begins with whatever that burning platform is, and then can expand creatively and purposefully to the other areas.
And we've definitely seen a trend in the past couple of years for hospital IT and operations to look to reduce costs and then reduce the amount of IT labor by consolidating vendors and platforms.
What do you see as the complementary hardware and software technology that is necessary to build a successful virtual acute care environment? And what kind of progress have we made to date?
AI is not a solution, it's a tool. And where the tool is tested, we're seeing confidence in deployment. As Equum, as a provider workforce organization, we see that AI could demonstrably change provider productivity and satisfaction. The reality is we're going to see two-dimensional care. We're going to see hospitals deploy and standardize on a bedside care management protocol. And we're going to have a second dimension of care, which will be a virtual care team. And those camera in every room, smart hospital installations will be supported by dynamic virtual resourcing that's driven by AI, that's driven by care plans.
We have been talking a lot about disconnected devices in the hospital environment and how organizations are now looking at bringing everything together on a single network. But when we transition this to the home environment, we introduce devices that are owned by the patients, or that are managed by the patients, which might not be available on the hospital environment. So how do we ensure that or de-risk the cyber threat from these devices when we want to implement the program at scale?
I would say the key challenge to really developing AI technologies is that we actually need access to kind of combine data from multiple hospital systems. And so there is some, I think, work in place to make sure that AI companies and different technologies can access de-identified patient data to start building models to drive patient care forward. I'm hoping that with reimbursement for wearables and with greater wearable technology, we'll actually start to see more acute patients being taken care of at home, hopefully reducing some of those like readmissions to the hospital or infections that they're seeing in the hospital.